these measures didn't start last week or a week before. These measures started in 2014. We experienced Ebola and we know what we went through with Ebola. We didn't want to experience this again. The government has been committed. Ebola exposed our weaknesses in a very profound manner. So we have been building capacity. We've been developing. During Ebola, we even didn't have a laboratory where we could confirm the virus. We didn't have isolation units. We didn't have doctors that were trained in containment. So we've been preparing. Our laws were a little bit deficient. We had no policies, no regulations, no guidelines. So now we've been developing those all through the past 3-4 years. We've built capacity, we've built laboratories, we've built isolation units. So it wasn't a question of if we were going to get another outbreak, it was a question of when. And now we know the when has arrived. And so we were relatively ready. We just had to beef up our preparedness. So under these circumstances, we knew there was an outbreak raging across the world. So our first line of defense was obviously the port of entry. So we, in conjunction with the federal government, remember that Murtala Mohammed International Airport is not a state airport.
Right.
It's a federal airport, and we have no jurisdiction there. But good collaborative efforts between state and federal, we sent in 30 doctors and nurses and an additional 30 a week later. So we have 60 Lagos State health personnel trained and now manning the Lagos State Airport in collaboration with Federal Port Health Authority.
Right.
And so we've tightened that entry port because that's the most likely place that a traveler will come in. Our focus initially was on Southeast Asia, but as soon as the outbreak spread to Europe, we did our mathematics and we know that there's more air travel between Nigeria and Europe, by far more travel, direct air links between Nigeria and Europe.
Right.
So we've tightened our surveillance of the European airlines coming into Lagos.
Okay.
Then, we established our emergency operation center. And soon afterwards, as we discovered that this outbreak was really not slowing down globally,
Right.